Well, first of all, the general lapse is going to be lapse in knowledge. So a veterinary technician not having the knowledge to interpret what they're being involved with. So if they put the blood into the machine and it spits out results, if they don't know what those results mean, that's the lapse there. And then the next step is, let's say they don't have that knowledge. The bigger lapse is them just saying, oh, okay, I have the blood work done, I put it into the file and put it in the chart. I think one of the biggest areas, since I'm in emergency critical care, is blood tests that are either too high or too low that are life-threatening, and a veterinary technician or a veterinary assistant not knowing the kind of alert values that we need, PCV higher than this or lower than that, we need to tell the veterinarian immediately. When I worked full-time in emergency and I had emergency staff before I went into education, I used to train my vet assistants, who would be doing a lot of the running of the blood work because the vet techs would be with the patients, to yell across the room from the lab what certain things were, like the potassium and the PCV, because if it was 7 or 8 or 9, I want to know the potassium is really high to go find the vet and get them to prescribe the treatment for that, as opposed to, oh, we did the blood work, and again, it's filed, put on the doctor's desk, the doctor's in a room, 20 minutes later they come out and go, why didn't anybody tell me the PCV was, or the potassium was 9? So I think one of those huge lapses is not understanding what those blood tests mean and how rapid interpretation and then and then knowing what comes next is really vital to patient care. Second one, I think, would actually be really not paying attention to proper sample handling and proper technique for even filling blood tubes and sending blood tubes out to the lab. When you have a patient who you're looking at the blood and you're taking these samples, it's not just as simple as poking them with any syringe and popping it in any tube. The lab needs, and I've worked with many people who've worked for IDEX and Antec and some of the large regional labs, and they explain the reasons why they really want good venipuncture technique, avoiding bruising, filling the tubes in the right order, because their tests can be completely screwed up if they don't do those things correctly. So you have this patient who's really low on blood and you're already drawing blood for them, and you send these tubes to the lab in the wrong order or in the wrong technique, or the smears you do are bad or whatever it might be, and the lab goes, well, we can't use this, and the lab is not directly in the clinic, so they don't know your patient is critically ill. So it's, again, really critical that the veterinary technicians are good with phlebotomy technique, venipuncture technique, and then even beyond that, which is sample handling, sample preparation, all that stuff. It's really vital. A lot of times I talk to vet techs and stuff who kind of brush that off. Oh, it doesn't matter whether I keep the needle on or don't, or those kinds of things, and it really needs to be standardized, because having spoken to the other side, clinical pathologists and people who work in labs, they say the sample is useless. There's cells that have been lysed, or the anticoagulant to blood ratio is off, and I can't run the right testing. So it's so important that veterinary technicians take that as being appropriate as well. So the lapse would be assuming that the needle to the vein is the only thing we need to worry about, not everything that happens after that.